the Maria Holder Diabetes Center.
Managing diabetes means treating the whole patient, not just blood sugar.
If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren, St. Michael. They can save your life and save you money. But members get 10% off.
Happy Wednesday, Q family! Welcome to the first Wednesday in September. Crop over might be done, Carifesta might be done, but you're about to hear 15 diabetic-friendly minutes on 100.7 QFM. All compliments to the Barbados Diabetes Foundation, the Barbados Diabetic Eye Screening Program, and the Maria Holder Diabetes Center. Good afternoon, this is Peter Boyce here. But you should know me by now, just like how you should know about the Maria Holder Diabetes Center, located in Warren, St. Michael, right behind Eunice Gibson Polyclinic, where if you are diabetic or pre-diabetic,
that's me,
and you have not gone there for the year, September might be a good time for you to remember to go to the Maria Holder Diabetes Center. But you might be listening to QFM, drinking your water, minding your own business, and you might be saying,
but why should I be looking to go to the Maria Holder Diabetes Center?
You heard what Miss Marsha White, General Manager of the center, said at the start of the show. She said this:
Managing diabetes means treating the whole patient, not just blood sugar.
And that is why you should be going to the Maria Holder Diabetes Center. They have everything there for you. There's diabetic eye screening. You're going to hear some more about that soon. There's podiatry foot treatment, because when you put on your good clothes to go to Q in the community tomorrow, and when you're stepping out, you want not only your clothes to look good, but you want your foot to be good too. And that is why you make an appointment to see podiatrist Louise Robinson at the Maria Holder Diabetes Center. And then there's dietitian Victoria Cox. You hear about how movie stars have personalized diets. Well, when you visit Victoria, you can get a diet that is especially personalized for you. Not for The Rock nor Tom Cruise, especially for you, to keep you healthy, to help you achieve your health goals. At the center, you can also find diabetes specialist doctors like Dr. Diane Braffett to keep you healthy. I call her the dancing doctor because you might have seen her participating in the recently concluded Carifesta with her dancing group. But at the Maria Holder Diabetes Center, you can find her dispensing valuable medical advice, which you can also hear on this show. Now, last week on QFM, you would have heard Dr. Braffett speaking on cardiovascular risks and how it impacts on you. And you may be saying to yourself,
what I would like to know is how to reduce my cardiovascular risks.
Well, Dr. Braffett has the answer for you.
So how do we reduce our cardiovascular risks? Well, let's relook at diabetes. So it means obviously we need to control our diabetes, and diabetes should be well controlled from the time of diagnosis. If you can reverse or put in remission, that is even better, and it is doable if it's diagnosed early for type 2 diabetes. If you're pre-diabetic, you want to get that into remission. Okay, so make sure that it's well controlled. That's number one. If you're diabetic and you have another condition such as the hypertension or the cholesterol, make sure your other NCDs are very controlled. Remembering having multiple NCDs increases the risk above just having diabetes. If you have diabetes and you know that you have complications, your risk is going to be now even higher than the person who doesn't have complications. Make sure that you're controlling your diabetes, but also make sure you're using the appropriate medications to reduce your cardiovascular risk. And what are these medications going to look like? We're talking generally about cholesterol reducing medications, and it's actually advised in all diabetics between the ages of 40 to 75 that they may need to be on a cholesterol lowering medication. Okay? And what do these medications do? It's not just about lowering cholesterol, but it's actually about melting the plaque out of the arteries. And that's why we encourage patients to be compliant with the medications. Nobody wants to take medication is true, but honestly, taking medication and living without the complications of both diabetes, high cholesterol, hypertension, and cardiovascular disease are very important. If you're living with cholesterol problems, high cholesterol problems, make sure you're getting that control both with lifestyle and medication if needed. Some people may be able to control it with lifestyle only, but a lot of people do need medication. Hypertension, make sure you're checking your blood pressure regularly at home. If you have high blood pressure, you should have a blood pressure machine at home that has an arm cuff, and you learn how to measure the blood pressure properly. We'll review this in another session again because it's very, very important. The vast majority of persons with diabetes that we see at the center are actually hypertensive, so managing the hypertension is actually very important, and knowing your numbers, but checking your blood pressures at home and taking your machine to your visits. And so therefore, remember, we want everybody out there to do appropriate screening for diabetes, high blood pressure, and your cholesterol as well. So we collectively and you can work on reducing your cardiovascular risk. Okay, so we're finished with our mouthful. I hope you've learned something today.
I learned something, and everybody listening to QFM learned something too. I heard everybody saying yes. Good. So now we are going to learn something about eyes. Specifically about eye screening for diabetic retinopathy. We have focused on that recently. And we don't want you to lose your focus and then next thing you know, you lose your eyesight. So we are going to go to Dr. Charles Spears, clinical lead of the Barbados Diabetic Eye Screening Program, to let us know.
It's important to recognize that many of us are actually blessed to have vision or good vision, but then there are other people in the world who are struggling with reduced vision, and we have to also do our best to maintain the vision that we have, such as making sure that we're controlling other factors such as our diabetes, glaucoma, all of those factors that can make a difference to our vision long term.
So you mentioned diabetes. What are the specific challenges that diabetics would have as it relates to their sight?
So in the early stages, people would probably not notice any significant difference in their vision. However, as the diabetes progresses and remains uncontrolled, then they might have specific challenges, for instance, in their central vision, or they might actually start to notice floaters in their vision if there's bleeding. And then at the very end stages, there can be scarring at the back of the eye, or you can have something called a retinal detachment. All of these can cause significant loss of vision. And these are all various stages of diabetic retinopathy, from the very early mild stage to the advanced stage where you have abnormal blood vessels growing or leakage at the back of the eye.
So how often should a diabetic check for diabetic retinopathy?
So this all depends on the stage of the diabetic retinopathy that you're diagnosed with. If you have no diabetic retinopathy or very mild diabetic eye changes, then you can be seen once a year. However, in the more advanced stages, then it will require more frequent monitoring.
And how is it checked?
So the check can either be an eye healthcare professional or your doctor having a look at the back of the eye with a special instrument, or you could have a digital screen where a photograph is taken of the back of the eye, such as at the Diabetic Eye Screening Program, and then this is analyzed to see if there are any signs of diabetic retinopathy.
So can diabetic retinopathy be treated or can it be prevented?
The main way that it can be prevented is good control of your diabetes overall, and if there are changes at the back of the eye that require treatment, there are several very good treatments available.
So what is cataract, and is it more common in diabetic patients?
So cataract is a clouding of the lens in the eye, and it tends to happen, well, everyone will develop cataract at some point, but whether you need to operate it very much depends on your own visual requirement. And unfortunately, it does tend to occur at an earlier age and progress quicker in diabetic patients.
What is glaucoma?
Glaucoma is a change in the nerve at the back of the eye, which causes you to lose your visual field. So you're not seeing all parts of your field of vision. And it's usually, but not always, related to an increase in the pressure in the eye.
And how can I check for glaucoma?
The best way to check for glaucoma is for an eye healthcare professional to check the pressure as well as examine the nerve at the back of your eye to see if there are any of these characteristic changes of glaucoma. So treatment depends on the stage of glaucoma. In most cases, it can be treated initially with either drops or a laser procedure. However, in the more advanced stages, this will surgery to control the pressure in the eye.
Thank you, Dr. Pierce. So you listening to QFM, don't be hard ears. Remember to make that appointment for a screening by calling 243-3937 as we go into our Q song of the day, and it's an eye song. This is Curtis Lee with Pretty Little Angel Eyes. Compliments the Maria Holder Diabetes Center.
Pretty little angel eyes, pretty little angel eyes, pretty little angel, pretty little angel, pretty little, pretty little, pretty little angel. Pretty, pretty little angel eyes.
Angel eyes, I really love you so. Angel eyes, I'll never let you go, because I love you, my darling angel eyes.
Pretty, pretty, pretty little angel eyes.
Angel eyes.
We have to also do our best to maintain the vision that we have.
I'm in your arms, feeling so heavenly. You know I love you, my darling angel eyes.
The Maria Holder Diabetes Center.
I know you were sent from heaven above to fill my life with your wonderful love. I know we'll be happy for eternity, 'cause I know, that our love is really real. Angel eyes, I really love you so. Angel eyes, I'll never let you go, because I love you, my darling angel eyes.
The Maria Holder Diabetes Center.
Another service which is available at the Maria Holder Diabetes Center is vascular or ABI screening. Let's hear what vascular spokesman Donald Clark had to say about this.
I should indicate that this is not a male-only condition because of erectile dysfunction, but female condition as well. Ladies with varicose veins has their condition to have this ailment. So I would want to say that women should also have this test done. Again, peripheral artery and peripheral vascular, which is different because arteries are arteries and veins are veins. But varicose veins is a telltale sign that there's a problem with peripheral vascular disease. In men, of course, it's erectile dysfunction. That is major. That's how you tell that there's a problem. That's how men would normally tell that there's something going on. There's no blood flow, or there's, I should say, reduced blood flow to the penis, of course. But in women, varicose veins is a telltale sign that there's also a problem. Peripheral artery disease, it's a simple test. It's called an ABI test, and I can't stress enough the importance of getting this test done.
If you are diabetic or pre-diabetic and listening to QFM right now, in 2025, Q stands for Quality Health Services at lower prices, which is what you will find at the Maria Holder Diabetes Center located in Warren, St. Michael. If you are looking for diabetic eye screening, vascular screening, podiatry, or nutritional advice, call 243-3937 or 417-0305 and make an appointment today. Don't miss next week when we will be dealing with more diabetic issues. Same Q time, same Q station. Compliments the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the Barbados Community Foundation.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
So it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care. You can reach them by calling 243-EYES 243-3937 for more information.
1 in 3 adults with diabetes also has high blood pressure. Don't ignore it.
The Maria Holder Diabetes Center.